to make sure.
Hello and welcome into this week's edition of AFMC TV. We're glad you're joining us. Today's topic is one that we are hearing a lot about here lately, brain fog. Joining me this morning is Dr. Beth Milligan, one of our doctors here at AFMC. Good morning, Dr. Milligan.
Good morning.
Okay, brain fog. Let's start from the beginning. What is it?
Well, first of all, the term is not really a medical diagnosis. It's actually just a term that people have come up with to describe how they feel when they feel foggy in their brain.
So this is a real thing?
Yeah, pretty much. I would say it is. It's a term that people use when they just don't feel right, when their brain isn't functioning the way they normally feel. They feel cloudy when they're trying to think.
So what could be some factors that might cause brain fog?
Well, what we found that usually chronic medical problems can actually create that and make it worse. For example, diabetes, people undergoing cancer treatment or any major medical procedure can actually feel more confused at times, and their thinking just isn't the way they normally think.
Does brain fog have any correlation with age? Does it get worse with age? Does everyone suffer from it, or is it unique?
Well, there's a normal amount, they say, of fogginess, you might say. I don't really like to use that word, but as we age, you can get normal times of it. For example, you can go about your day and suddenly forget the name of your friends or a date, and that might pop into your head. And that's kind of where we might say is fogginess, or maybe doing too many things at once and create that. And it seems to happen more so as we age. But some people are just fine, but it can be normal and not anything to worry about.
You make a good point, and I want to go back to it. When you said just a moment ago about trying to juggle too much, and we all hear about multitasking and how we just need to do more and get things done at all costs. Could the multitasking, could we really have maybe too many tabs open in our brain that somehow it causes the fogginess that we experience?
Some people thrive off multitasking, but a lot of us, and I'll say it myself, working 3 different jobs at times, I can feel a lot more stress. And as you feel more stress, that's when you start noticing that you can get confused or get foggy at times. And it can be quite frightening, but it's not really something to worry about. You just need to slow down and stop multitasking and focus on what you're working on.
So then my next question would be, how can we minimize brain fog? Does it correlate with prioritizing sleep or eating a healthy diet or getting exercise or as you said, slowing down?
You actually answered the question right there. It's a complex answer, and to focus on what is causing your problem. For example, if it happens acutely and you suddenly have brain fog that you don't normally have, that's actually a medical reason to go seek professional help and say what's going on, and they'll help you focus. It could be a chronic medical problem, but perhaps that it's slowly going on. Then you need to look at it and you could take care of it yourself. And one thing is, are you sleeping properly? Are you eating properly? Are you missing meals and maybe getting your blood sugar dropping down? Are you getting enough exercise? Are you just taking care of yourself?
Could brain fog be an early indicator of Alzheimer's or dementia? Some people might be fearful if they are experiencing brain fog that this could be baby steps down a slippery slope.
Unless it acutely happened, the majority of time that brain fog and cognitive decline that you see with Alzheimer's or dementia, they're different completely. So you don't need to be afraid, and you're not having dementia, Alzheimer's, because you forgot your friend's child's name.
Can our phones or our screens have any impact or play any role in brain fog?
They've actually shown that people who spend a lot of time on their phones or any device staring at it for long periods of time can actually, with that back white backlight can actually increase the chance of getting a little bit of brain fog, because when you look away, it's really hard to have your eyes adjust. And so that's actually been linked with actually increase in brain fog, or all of those things that go in that category.
So anything else that we need to know on the subject of brain fog if we are experiencing it?
Well, one of the things that I read as I researched this topic was they say you just need to slow down and start focusing on the now. We're all rushing in multiple different directions and getting stimulated way beyond what we need to be. And people need to take 10 minutes and just focus on the moment they're in and just relax. If it's stimulus, get away from it, go to a quiet room and let your mind think about the now and the moment you're in, and just let your body calm down. And that's probably one of the best things you can do when you start noticing you're having these things happen.
What great advice for so many ailments. Slow down and being present.
Absolutely.
Okay, Dr. Milligan, thank you so much for joining us today.
Thank you.
Joining me now is Rebecca Denniston with Dermatology Group of Arkansas. So good to see you.
It's good to see you.
So, okay, we are T-minus and counting spring break time.
That's right.
Spring is in the air. And that also means our skin routine probably needs to change a little bit. So maybe let's start by just, as we come out of the deep freeze of the winter, what are some of the things we need to change kind of right off the bat as we're in that transition going into spring?
Yes, definitely there's things that you want to change. So, a lot of times in the winter, we're going to be using our thicker moisturizers, things that, really keep us from having that dry skin. And you'll notice as we get more humidity in the air, things are not as dry. You probably don't want that thick moisturizer. Yeah. So that's probably the number one thing to change. So you want to do a lighter moisturizer, and then really making sure that you're amping up your sunscreen is the other big thing, because fall, winter, you're not in the sun as much.
Sure.
As soon as it starts getting nice outside, hits the 70 degrees, you're probably going to be out more.
Sleeves get rolled up.
That's right.
Everybody gets outside.
Yes, exactly. So sunscreen is going to be a big thing, making sure you are starting to load up on that. Wearing your hat when you're outside, those kind of things are what you want to look at doing.
So if we are doing spring break skiing,
sure,
what are some of the things that we need to do to protect our skins just to be safe?
Yeah, so you'll probably want to go back to a thicker moisturizer when you're, in the mountains. Definitely you're going to see more dryness than you would here in Arkansas for sure. So your thicker moisturizer, and then humidifier. A lot of times if you're going to be, going skiing or in the mountains, something like that, a lot of places will provide a humidifier now because it's so dry in that climate. And then the other thing is going to be your sunscreen. So people kind of forget, even if they're skiing, it's cloudy out, you're still getting sun, and you can easily get a sunburn while you're skiing on the mountains. And then also one thing that people forget about is your lips. Lots of chapped lips, that kind of thing. So you want to do kind of more emollient type lip balms, thicker lip balms, and that'll help as well.
And looking for a lip balm even with SPF, because I would imagine, this little area right here, all of that could get burned so quickly.
Definitely, yes.
If you're not paying attention as you're putting it on.
Yes, for sure. Yeah, I think investing in a chapstick or a lip balm that has SPF 30 or higher, that's what you want to look for, and just reapplying it throughout the day is a big thing.
Okay. Now let's head to the more tropical climate. And this kind of goes without saying, right? Your sunscreens, your hats.
Oh, definitely. Yeah, I think so. Couple things. Sunscreen, hat, rash guards are a big thing that you can do. So if you're going to be at the beach, warmer climates, and you feel like you're burning, maybe you throw on that rash guard, long sleeve. A lot of them have UPF protective factor in them now. Wide brim hats are going to be really good for you. And then the other thing is hydration. A lot of times you're going to be in a warmer environment and you're going to be sweating more, all that kind of stuff. But really it's the sun is the main thing you want to be protected from in that type of climate.
So let's say in either case you come back and you're burned, despite your best efforts. You
Sure.
have some type of sunburn.
Yes.
So then how do you treat, or how do you treat that night when you go,
Yes.
how'd this happen?
Yes. So a couple things. I think cooling off the skin is going to be your number one thing. So of course, aloe vera is kind of the first thing that comes to our mind, and it does work very well. I usually tell people to keep some in the refrigerator. So when you put it on, it's nice and cool. And that's kind of what you're going to want to do right when you have a sunburn. And then sometimes sunburns can be painful. And so you can take NSAIDs like ibuprofen, Motrin, Aleve, something like that if you feel like you're just uncomfortable. And then, of course, if you have a severe sunburn, we need to see you in clinic, but hopefully not.
If you don't have aloe vera, could just simple ice packs help?
Definitely.
And maybe some lotion because I would think you probably don't want the skin to crack.
Yes, exactly. Yeah, you want to keep it really well moisturized. So, good thick moisturizer is going to be helpful. And then definitely you can do ice packs if you're uncomfortable, for sure.
Okay. Anything else we need to know, whether we're headed to the beach or headed to the slopes?
Yeah, I think that one of the big things is reapplication of your sunscreen. A lot of people forget to do that, and it is hard to do, especially if you're sweating a bunch and you don't want to reapply. But really, if you're sweating, you need to reapply about every hour. Otherwise, it's every 2 hours. Okay. And then another thing that you can do are powder sunscreens. So some people don't like the kind of thicker, lotion type sunscreens. And now there's powders. So there's a great brand called Color Science, which is SPF 50. Okay. And it's a powder based sunscreen. It's not really like makeup. It blends in with, any skin tone. And actually a lot of my male patients really like that.
Okay. Yeah.
Because they don't feel like they have something thick on their skin.
Yeah.
So that's something else you can do.
And what is a good SPF number we need to kind of look at? Is there a threshold where really SPF 90 really isn't good? You could stick with a 35 and be just as well, or?
Yeah, so really SPF 30 or greater is what we recommend. Okay. When you get over 50, they kind of equivalate themselves. Okay. So I still think SPF 50 is great, but the SPF 100, 75, those are all about the same. Okay. So yeah, you don't want to necessarily buy 110 SPF. I mean, you can go with something lower if you need to.
Okay, so 30 to 50 is a decent range.
I think that's great. Okay. Yes, definitely.
All right. Yeah. Becca, thank you so much. How can folks get a hold of you?
So I'm at the Dermatology Group of Arkansas. We've got multiple locations, and we're happy to see you.
Okay. Thanks so much for joining us.
Thanks for having me.
And thank you for joining us. We'll see you back here next week for more AFMC TV.